They say dog is a man's best friend, but for many of us, there are family members. And if our family member was sick and there wasn't much we could do to help, why wouldn't we try dog physical therapy?
Yeah, Nebraska law allows licensed physical therapists to get specific certifications to be able to work with animals if they get a veterinarian referral. New this morning, I met with a doctor who brought this unique animal physical therapy to the state, who says this is the future for pet care.
Things here and just kind of demonstrate.
Bucky is one of Dr. Peck's furriest clients. Dr. Peck is a physical therapist for humans and canines, a medical concept that is still very new in the U.S.
Actually carry 2 licenses in Nebraska, one to treat humans and one for animals.
In Nebraska, he was the first physical therapist to get certified in canine and equine rehabilitation, making him only one of 3 certified in the state.
There we go, Bucky, square up. Here we go. We had to actually change their state laws for the practice of veterinary medicine first, and then we had to write regulations for it, working with the board, and that took several years for us to write the additional educational training requirements. Dr.
Peck said it's a more natural way to treat everyday injuries.
And you'll see we can't do this at all. And that's telling me right here that there's some hip or related issues here in the back and the knee that we're going to be working on here a little bit. So you've got veterinary medicine, but on top of it, there's cases where they need surgery and you need post-op care, just like in humans, or they get regular injuries from, say, sporting events, agility dogs, hunting dogs, sheep herding dogs, you name it. They're going to have common injuries just from their activities. Go to your left. There we go.
A benefit not only for the pets, but also the vets, like Dr. Drew Olson, who owns Farnham Pet Hospital downtown.
For pets that may be having issues with different medications or side effects, or they're having reactions, well, now we can actually start on physical therapy or rehabilitation first.
Dr. Olson says he's already seen success in the new partnership.
Necessity is the biggest driver of progression. And I had a patient he was over 160-pound Mastiff, and he lived downtown. And he was on chronic medications. And basically, he wasn't able to walk anymore on the current medications. I didn't have any other options, especially when I upped dosages or tried different medications, we would have reactions.
It's on a regular basis.
The concept is even giving pet owners more hope for the health of their dogs.
A lot of times dogs that are this big don't live this long, so I'd like him to live forever. So I'll pretty much do whatever it takes to help him stay mobile, because once he can't get up, that's the end.
The therapy is done with the owner present. Their job is to continue the therapy at home.
I always have to hear from the owner, what is the dog not doing that they were, because that becomes kind of the key sign to see if they automatically return to doing it. And the dogs are interesting because if they stop doing things like jumping up on furniture, there's a purpose behind that. And when they feel better, they don't tell you, I feel better, let's go try this. They just go do it.
Dr. Peck is now helping the concept of canine physical therapy grow. He is the chair of the Department of Physical Therapy at Creighton University and is offering this unique experience to students.
And that was totally what motivated me to put Creighton on my list and apply right away. I think I applied a few days after.
As students like Lisa Ferguson are finding, it's much different working with the canines.
That they can't follow, verbal cues like we normally give to humans. So it's a lot more manual and just kind of, motivation with treats and fun.
Now, Dr. Peck also treats horses, which needs its own separate certification. He's the only doctor in the area to be certified in both canines and equine.